This is the Healthcare Marketplace Specialization, Healthcare Marketplace Overview. I'm Steve Parenti, and this is Module 5.2.5, Information Technology for Integrated Healthcare Delivery. In front of you is a picture of an integrated delivery system with different levels in that system, and then associated here on the left we can see decision support, life support, data, and hardware. We've talked about these things before in the context of a health IT pyramid, where one of these things, like the hardware layers, could be interchangeable while the other layers are being used. And the life support layer, again, is referring to very vital systems, whether or not they be laboratory, radiology, pharmacy, that need to be used inside a hospital. What I'd like to do is give you an illustration of what different institutions may have available to them. We've talked a lot about what the insurers and providers have. This is a story where someone has, say, a care pattern or a given patient over a fairly short period of time and has some interesting information to be revealed. So if we start off, we can see that this person starts off with a primary care visit. That's what PCP stands for, primary care. So that could be an internal medicine doc, general practitioner. They then also have a laboratory test that is ordered. They, after that, go to see a specialist. Could be cardiologist, could be someone more advanced than that. They then do a biopsy, which is a surgery to usually to look for cancer. So that specialist visit could very well be to an oncologist. You can check the specialty code and see. And then surgery. From that surgery, there's subacute care, which is a lesser form of inpatient care mostly for recovery. So the big question is, with this information, we have a time series of events, but does this tell us anything about what's going on inside that patient's life? So with this information here, if we go forward, the information that's available to that insurance company, these are all the things that you're looking, again, at the hospital level. This is all of this is hospital information, particularly this clinical information. And what I want to focus on the fact is that if an insurer has to use this information to talk about what kind of quality of care that's available, what we'll see is there's certain information that is now missing. All that clinical information that we were looking at here is now gone. The radiology and other information, that's not available to the fee-for-service insurer. This other information about master patient indices is not available. This dot here for order results is not going to be available as well. Information on the patient's records is not going to be available in terms of different identities they might have. And then additional information on clinical staffing won't be available as well. So it's actually come down to a very limited view that insurance company has available to them. So if we haze this out again, there's just a lot of information, whether it's communications between the staff, inventory control, for example, what type of implantable cardiac defibrillator made someone put into them if it's a cardiac patient, some information about images. All that stuff really isn't available to the insurance company, but it is available to a staff model HMO. Actually, the British National Health Service would be the same sort of thing for a single-payer system that truly is a national health service design if their systems are integrated. Now, if we look at the view the provider has, people generally say, well, the physicians and the hospitals, they have the best data. And so here's what data they would have available to them. That same patient we talked about before, we would see a referral to the specialist, that's that internal communication. We'd see a diagnostic test reporting that the white blood cell count is high. We see also a report from that biopsy likely that the cancer that was being tested for is metastasized, and that a confirmation that cancer is malignant, meaning that it will probably kill that person or at least severely maim them and remains. Now, why do we focus on this? We talked about this system before. There's this issue about what care is available to a given patient. And so we know that here we have these systems of care that are available here for, say, one person in one care delivery system. But the concern is that if there are other care delivery systems that are not necessarily part of that care system, all that information is not connected. Now, interestingly enough, that's the case for the provider, but for the insurer, they would see all this information. Medicare or a commercial insurer will see all the different sites of care in terms of the billing. They just won't see the clinical level of detail that one would like to see. So if we put all this information back together now, the same person has a sequence. The primary care visit occurs, there's a lab test, specialty visit, biopsy, surgery. Then we put in all this other information that's here. It's a different sequence. We can see that because of that visit to the primary care physician, there was a referral. There was then a lab test done. The specialist visit actually looked at that lab test. They go further to see evaluate that the white blood cell count is high. They then go forward for a biopsy. From that biopsy, we see the cancer is metastasized. Recommendation for surgery. Then we see that that actual cancer remains as the post-operative notes, and then recommendation for subacute care. Point of this is that having both sources of data is really the ideal. Having just one source of data, provider, insurer, is good, but it's not as good as having the two blended together. And really, when we look at this picture of all the things that Health IT is supposed to do, what's in yellow, again, are those things that we'd like to see or are happening right now. Everything that's in red are the things that have to be built if we really want to have a much more robust Health IT system in the future. And without those systems, we're really not going to be making the progress that we'd like to see in the long run. This concludes this module on Health IT applications in the insurer and provider markets.